Hi guys, how are you all? Hope you all are fine. Hope you all are enjoying too. And my blessings are with you all. My best wishes are with you all. May God bless you always and forever. And stay happy, stay blessed, and uh, may God bless you always and forever. Hey guys, myself Dr. Sonali Patil, the extreme feminist comrade Dr. Sonali Patil Liberal, welcomes you back to my YouTube channel. And today I had came in front of you by taking a very extremely rare topic of the nervous system, that is the neurocysticerosis. One of my friend asked me to cover this topic on my channel. So let's get started. So what is neurocysticerosis? Neurocysticerosis is an extremely rare disease of the central nervous system affected by the tinea solium tapeworm. It is a parasitic infection. It affects the brain, muscle, and tissue. And this tinea solium or this tinea saginata, it is the source of infection is the contaminated food, dirty hands, then unhygienic conditions, and this is by fecal-oral route. There are two cycles of this tinea solium, that is the tapeworm, first in the human beings and second in the pigs. In the human beings, it is consumed by fecal-oral route or or in the areas of poor sanitation or the dirty hands, infected, contaminated food, contaminated water by the this tinea, this is tapeworm. Our major source of the infection is the food, that is the uncooked pork containing the species of this tinea solium. Also the pigs are affected. Human beings and pigs, they both contain the larval form of the tinea. Now in the pigs, it is transmitted through the human beings also due to the feces containing the eggs of the tinea solium. They get infected in the intestine. From the intestinal mucosa, it enters the bloodstream. From the bloodstream, it gets entered into the brain, then spinal cord, various tissues and muscles of the body, and the patient gets infected. So this was about the source of infection of the tinea solium or tinea, that is the tapeworm manifestation. So now we will see what are the clinical features of this tinea solium, that is a neurocysticerosis. When it affects the brain, when this parasite affects the brain, it is called as the neurocysticerosis. Neurocysticerosis is the extremely rare disease of the nervous system manifested by seizures. The cause of infection is the larval cells of the tinea solium. What are the symptoms? There will be rise in the intracranial tension. The cystic larvae of the tinea solium appears in the brain, which is detected by the biopsy. Then there is hydrocephalus. There is a cognitive decline. There is nausea, vomiting, abdominal pain. Also, it affects it captures the cranial nerves of the brain, resulting in the facial palsy. Then in the this thing, trigeminal neuralgia. Also causes the focal neurological deficit due to the presence of the parenchymal this brain cycle. There is also a ischemic stroke due to this parasite. There will also be ischemic stroke related to the occlusion of the small arteries of the brain. There will be stroke. There will be extracranial. There is an entrapment of the cranial nerves, resulting in paralysis of the extraocular muscles, resulting in the hearing loss, facial palsy. There is a trigeminal neuralgia. There will be also a radicular pain. Now, when it affects when the ventral intracranial tension is raised, there is also one of the symptoms which is called as a severe headache. There will be vomiting, there will be abdominal pain. So these were about the various symptoms of the neurocysticerosis. How are we going to diagnose the patient suffering from the neurocysticerosis? First is we are going to do the neurological studies. That is, first is the CT scan, the second is the MRI of the brain, the serological test, the ELISA test. The ELISA test includes the death of the detection of the anti-cysticerol antibody by the ELISA test. Biopsy of the brain and spinal cord can be done. There is in the CBC count there will be eosinophilia. So this was about the detection of that is the diagnosis of the neurocysticerosis. This topic is very huge and made it very short and very short and summarize the topic. Now, what treatment you can be give to the patient suffering from the neurocysticerosis? The treatment is entirely symptomatic and depends upon the cause of the disease. Also, the albendazole and praziquantel antiparasitic drug should be given to treat the neurocysticerosis. There are two criteria for the diagnosis. Also, I forgot to tell you there is absolute and relative both diagnosis for the neurocysticerosis. In the absolute criteria, there is histological proof, that is the biopsy of the brain and the spinal cord, and also there is retinal cysticercosis visible on the fundoscopic examination. When the ophthalmologist do the fundoscopy, there is a evidence of the this retinal cysticercosis on the fundoscopic examination. So this was in short about the neurocysticercosis. Hope you like my topic. Please hit the button like if you like it, and subscribe my channel. Thanks a lot. Love you all.